Welcome to my channel. My name is Caitlin, and today I'm going to be telling the story of how I broke my neck. So it starts in 2014. So today, towards the end of 2014, I decided that I wanted to try pole dancing classes. So my mom and I went together and we tried out a class, and I immediately loved it. I was hooked. I wanted to go back for more classes, and that's exactly what we did. We started going to pole dancing classes a couple of times a week in the evenings at a studio near to where we live. So that we carried on doing these pole dancing classes from the end of 2014, and we carried on in 2015 as well. In 2015 I did my first performance, my first showcase. I absolutely loved it, and I loved the feeling of being on stage and choreographing a routine and performing it. I decided that I wanted to carry on doing more. So in 2016 I started looking at entering some competitions, and there was the 2016 studio showcase that happens every year that I wanted to perform in again. So I started training more and more. I would go for extra lessons to help with choreography and creating these routines, and I was at the studio quite often. And then one day on the 15th of September in 2016, in the evening, I went to a class. That class that I went to was a class that I went to every week. What we would do is there was a stretch class and then a pole class directly after. So I would usually do, we call it doing the double, and I would do the stretch class and then the pole class. My mom would do the stretch and pole class with me, and at that point my sister was also coming to the stretch classes with us, but she didn't do the pole classes. She would just sit and wait for us while my mom and I did the pole class. So we did the stretch class, and then I was in the pole class, and during the pole class we were trying out a move called brass monkey. And from brass monkey, there's a move that you can go into called brass bridge. If you're a pole dancer, you'll know exactly what I'm talking about. If you're not a pole dancer, I'm going to put a picture up on the screen and you'll see exactly like what the move looks like. So that was the move that I was doing, and it was my first time ever trying this move. I had done brass monkeys before, but I'd never done brass bridges before. And I tried the move. I immediately got it on the first try. It felt really comfortable, really easy actually. And the first time I tried it, I had the instructor spotting me. She was like right underneath, like ready to catch me if anything happened, and nothing did happen. I thought that I was fine, so I was like, okay, let me try again. And I asked my sister to take a picture of me. So I got into the move, the instructor helped me into it, was there while I was getting into it to make sure nothing happened. And then because I wanted this picture, the instructor then stepped away to step out of the frame of the picture. And in that moment, I lost the grip on my leg and I fell out of the move, and I fell onto the floor and I landed on my neck. So that was the accident. So I fell and I landed on my neck, and immediately as soon as I fell, I felt that I couldn't move at all. I felt like I couldn't move my arms, I couldn't move my legs, and I immediately started shouting, and I started shouting, I can't move, I can't move, I can't move. Very luckily for me, in that class was someone who happened to be a paramedic. So she, again, was very lucky that she was there, so she managed to come over. She immediately told everyone to kind of like back away, not move me at all. And because I was in this very like awkward position where I was basically in a back bend, like lying on my like chest with my neck like hyperextended into the position. She then managed to log roll me out of that position so that I was lying on my back. At that point, I still couldn't feel anything. I was very like panicked. I was I was really, really worried. I had no idea what was gonna happen. It felt surreal. It felt like the whole experience, it felt like it wasn't actually happening to me. It felt like something that happens in a movie. So then after that, we waited for the actual paramedics and the ambulance to get there. The person in class who was a paramedic, she had a friend that was on call and in the area, so she phoned him directly, and he arrived pretty quickly and was able to kind of like assess the situation, and he had all of his equipment there to take my vitals and all of that. And then the actual ambulance that was supposed to take me to the hospital arrived. I think it was only a few minutes later, but it felt like forever while I was there waiting. I got then transported, put onto a stretcher, transported in the ambulance to the closest hospital, which was actually only like 5 to 10 minutes away from the pole studio. And I went into the emergency room there. There was a very, very, very kind nurse that was kind of like overseeing me and looking after my case basically while I was there at that hospital. And she was really, really kind. She was like checking up on me. She was checking up on my family as well, because my mom and my sister had obviously been in the class. So my mom was able to ride with me in the ambulance, but only one person was allowed to come in the ambulance. So my sister had to stay at the studio. My dad then went, my mom obviously phoned my dad when once the ambulance had been called and everything. So he then came to the studio, he picked Jade up, and then he met us at the hospital. So my mom, my dad, and my sister were all there at the hospital. And then I got imaging done, x-rays done. At that point, they thought that it was my C4 vertebra that had been broken from the imaging and the x-rays that they'd done, or they were worried that it was my C4 vertebra that was damaged. So they were not putting me on any sort of strong painkillers or any sort of sedation, because they were worried that if I went under, basically, that I might lose my airways, might lose my breathing because of the potential of it being a C4 injury. So they were not putting me under any sort of pain medication or sedation at that point, and they then called the neurosurgeon, and they were waiting for a response from the neurosurgeon because I needed to go into surgery. At this point, it was a lot of waiting. I was in the ER, I think, but my memories are like all very like vague of this point of like what like the environment was like and what the room was like. I was only basically seeing the ceiling. I was stuck on my back, unable to move at all. My neck was in I was on like the blocks, and my head was being like stabilized so that I didn't move at all and possibly like damage my spinal cord further. So I couldn't like really look around at all. But what I can remember from this point was that I was experiencing the most intense, extreme pain in my right hip. It was so bad that I actually asked the doctors and the nurses that were working there if they could take me for x-rays to go x-ray my hip, because I thought that I had broken my hip in the fall. I was convinced that that sort of pain, there had to be something like wrong or broken in my hip with how intense it felt. I think like looking back now, it was just like must have been nerve pain referring from the injury, but it was the worst like pain I'd ever experienced, I think. I don't actually remember any pain associated with like my actual like neck when I fell. It was just that pain in the hip. So that was a whole lot of waiting. And then the nurses were still trying to get a hold of the neurosurgeon at the hospital that I'd first gone to, and they weren't getting a hold of him. So the very nice nurse that was kind of like looking after me and like my case made the decision to airlift me to another hospital because the neurosurgeon obviously wasn't responding, and she felt that it was just best that I go to another hospital. So at that point, they then called the helicopter. The helicopter arrived fairly quickly, and then they did at this point put me under some sort of like sedation. I'm not sure exactly what they gave me, but it just made me feel like very like woozy and yeah, like quite like out of it. And the reason that they sedated me at this point was because they needed to make sure that I wasn't gonna like move at all during the helicopter ride, because obviously the helicopter ride can be a bit bumpy, and they needed to make sure that my neck wasn't gonna bump. So what they did was they had these like inflatable things that they blew up and they put like around my neck, so it was basically like I was in this jumping castle, and these inflatable like balloons were either side of my head, keeping me in position. But the nurses and the doctors at that point were worried that I might get claustrophobic and might start to panic, and that I might try and like move my like head around at that point. So that's why they put me under the sedation. Then after that, I was airlifted to the other hospital. I arrived at the other hospital, went into the emergency room there, the trauma unit. There they reassessed me. They did more imaging and more scans. I think CT scans, MRI, X-ray. That process took forever. I remember being, I think it was in either the MRI machine or the CT machine, and I was there, and it was freezing cold. I had just like this thin sheet over me to kind of keep me warm, and I was in there for what felt like hours, just like staring at the inside of this machine, waiting for it to be done, not again being able to move or do anything. Then after I was like processed like through the emergency room and they'd taken all the imaging and everything, they took me into the ICU. Then I think this was the first time I met my surgeon and my neurosurgeon, and he basically told me and my family like what was going on. He confirmed that the injury was not a C4 injury, it was a C5 injury, and then he then explained the operation that he was going to have to do, and it was going to be a fusion from C4 to C6, but they couldn't do the operation that night because I'd fallen during the class, which was an evening class, so it was around I think 7 p.m. and I think like at this point it was now like past like midnight or getting close to midnight, but either way they weren't going to be able to do the operation immediately and that night because they had to order the metal cage that was going to go into my neck. So the way it works with a fusion is it's basically like a spacer, and they replace the vertebra with this like metal spacer cage contraption thing. They place it in there and then they secure that to the vertebra above and the vertebra below so that it doesn't shift in any place or doesn't move, and then new bone actually grows into the metal cage that they've placed there. So that was the operation at C4 to C6 fusion. The next morning, I think it was in the morning that I went in for surgery. I was obviously sedated for the whole surgery, so I have no idea what was going on, but my parents and my family were all waiting outside the operating room. So during the surgery, what the neurosurgeon had told my parents before going into the surgery was that he really had no idea what the damage to my spinal cord had been, and that during the surgery, while he's taking out the pieces of the vertebra that had like completely shattered and replacing it, that there was a chance that after the surgery I would end up permanently paralyzed, but there was a chance that I would be able to recover. I think there was also quite a high chance of me dying during the surgery. I actually didn't like find out about this until after the surgery had actually been done. The neurosurgeon, although I was like of legal age and I was like technically an adult at that point, before that like fusion, before that surgery, he mostly just spoke to my parents. I didn't really have that much interaction with him, besides for him just like introducing himself to me and saying that he was the one who was going to do my surgery. But then after the surgery, I got the chance to kind of like ask him a lot more questions about what was going on and everything. It was just before the surgery that he mostly spoke to my parents. So then I got out of the surgery, I got taken back to the ICU, and they then were waiting for my neck brace to come in to kind of keep my neck again like stable and in place. And in the meantime, I was still on the orange blocks that were keeping my head stabilized and in position. And then it was pretty soon after the surgery that they started doing physiotherapy with me. So I had 2 physiotherapists that would come to me once a day while I was in hospital. The physiotherapists would change, but it was always 2 of them that would come, and they would try and get me to do things like sitting up in the bed. I remember it was like a really big like achievement when I managed to move from sitting up on the bed to then moving to the chair next to my hospital bed. And then they were also trying to get me to start walking as well. So by this point I was slowly gaining back a little bit of movement and a little bit of like ability to move my limbs. So they were starting to get me to try and walk, and they would have me like walking up and down the like hallway of the ICU, but obviously like with support they would be like either side of me, and at this point they were kind of doing most of the work. I was not really doing much, but it was at least like getting me moving and getting my muscles like moving again. They really wanted to try and get me moving as quickly as possible to prevent like as much muscle from atrophying as possible. After spending a week in the ICU, my surgeons and my like medical team had made the decision that I was ready to be moved out of the ICU. I was doing really well, and they didn't have like any concerns that would warrant me staying in the ICU any longer. So they then started the process of getting me transferred to a rehabilitation hospital. I remember I was so excited to be transferred. I couldn't wait to get out of the ICU. It felt like this big like milestone and this big achievement in my recovery that I was able to leave the ICU. But then there kept being these delays of getting the paperwork signed by insurance and getting everything organized. So I was supposed to be transferred. I was supposed to be transferred on the Thursday, but then we had to wait for the Friday, and then we weren't sure if I was going to go on Friday, and there was a possibility it would be delayed over the weekend as well. But then I think I ended up going on the Friday, so it was like a week and 1 day that I was in ICU, and then that Friday I was transferred from the ICU to the rehabilitation hospital. So then I made it to the rehabilitation hospital. They transferred me just in an ambulance, and then they wheeled me in on a stretcher into the ward that I was staying in the rehabilitation hospital. Then when I got there, a physio and an OT came up to the ward and up to my bed to do an assessment with me, and they basically checked me out. They did like tests for my movement and my sensitivity and responses, to kind of see where I was at, and then because I'd moved that day, I didn't have any like official like physio training sessions or OT training sessions that day. I kind of went to bed, and then the next day, my like full routine for while I was in the rehab started. So then my routine in rehab started. I had 2 physio sessions a day, 1 OT session and 1 group session. I was again in the spinal cord ward, so all of the people that I was kind of like interacting with and that were in the same physio like rooms and the same group sessions as me, in the same ward as me, all had spinal cord injuries. So my 2 physio sessions would be like individual, just me one-on-one with my physio. I had 1 like main physio that I had for the duration of like my stay in the rehab, and then I had there were the other physios in the ward that I would also sometimes work with, but mostly it was just my main physio that I worked with. Then my OT sessions as well, again I had 1 like main OT that I worked with, but then sometimes I would do work with the other OTs. And then the group sessions, sometimes that would be OT, sometimes that would be physio, and just one of the OTs or one of the physios from the ward would facilitate a group session with everyone. I really pushed myself while I was in rehab. I was in my physio sessions. I would arrive as early as possible for my physio sessions. I would stay later in the afternoons in the physio room. There was like this big room that had all the like physio equipment and different kind of like areas and stations that everyone would go to for their physio sessions, and then you would go then back up to the ward for the rest of your day. I would try and spend as much time as possible in the physio rooms, just working on whatever I could work on to try and improve. This was partly because I really wanted to try and get better and try and regain as much function as I possibly could, as quickly as I could. And this was also partially because it was really boring in the hospital. I was in the rehab hospital for about 2.5 months. There's obviously like a lot that was involved and a lot that happened during those 2.5 months, but too much to really get into for this videos and for the purposes of this video. I had good days where I felt like I was making a lot of progress and that I was really like successful and really actually enjoying myself despite the situation that I was in. But there were also days when I just felt like crying, and I felt like I was never going to leave, and that I was never going to recover, and it got rough at points. But I made it through. Towards the end of my stay at the rehab, they started allowing me to come home for the weekends. So I'd be at the rehab for the week, and then I'd be able to come home for the weekend and at least spend the weekend in my own house, in my own bed. And that was really nice, and that motivated me to like work even harder to be able to come home like permanently. And originally when I was admitted, they kind of gave me a timeline of like 6 months to a year that I would be there. They kind of said, we don't know, but maybe 6 months to a year. And then after being there for a couple of weeks, they were like, okay, you'll probably be out by January. And then they eventually set my date of release. I think they set it sometime in December, but then they moved it up by like 2 or 3 weeks into November. And so after 2.5 months, I got released from the hospital. I got to come home and I got to stay in my own house, my own bed, and I became an outpatient. So an outpatient basically just means that I'm not staying in the hospital any longer, but I was still doing physiotherapy. I didn't go for outpatient sessions at the hospital that I had been at, the rehab hospital that I had been at. I went to one that was closer to home because it was just an outpatient center, so they didn't have any inpatient facility, but they did come like recommended from the physios that I had at the rehab hospital. So I went there and I was doing physio and OT sessions several times a week, and that lasted for a couple of months. I think, yeah, a couple months to a year that I was doing the outpatient sessions very regularly now. And today I don't actually go to physio or OT anymore. I do see a biokineticist, and I've got certain exercises that I know that I need to kind of like work on in order to still carry on improving, but I don't actually have to go for outpatient treatment anymore. I often get the question of whether I'm like fully recovered now, or if I have any lasting impacts. And there are like some things which I'll discuss in a moment that still kind of impact me to this day, but I will for the most part say that I am fully recovered. With a spinal cord injury like mine, which is like an incomplete injury, and most of the damage was actually caused by the spinal cord swelling itself, there's a possibility that I will continue to recover for even years into the future. Although I can definitely tell like improvements that I've seen have slowed down a lot, especially since that first kind of year. The first year was when I saw the most improvement and I made the most kind of rapid recovery. But since the end of that first year up until now, I have seen improvements. It's just been a lot slower. So I think that will continue. I can't actually really say though, and no one can say for certain if I will improve and like recover more, or if this is kind of me as I am now. In terms of the kind of like lasting effects, I obviously have the scar from my surgery. That's always going to be there. It faded quite well. My surgeon did it really nicely, where he like put the scar exactly in the fold of my neck. You can barely see it. You can actually see the staple marks because this incision was stapled together. You can see that more than you can actually see the scar from the incision. So that's there. Then because of the paralysis, what happened was the level of the paralysis meant that I could use my like upper traps and my neck muscles. Those were all still intact, but obviously everything below that was affected. So as I was like recovering and as I was like still mostly paralyzed, my upper traps actually started to take on a lot more of the like work of the movements that I was doing, and started to compensate a lot more for the muscles that weren't really working as much. So now I have very overactive upper traps that kind of take over in a lot of the movements and a lot of the exercises that I try to do. And then because of those upper traps being overactive, I have pretty constant like knots in my shoulders. So I do go for like sports massages with my biokineticist every so often to help with those. And then I have a lot of just like tension in my neck, muscle tension. The muscles are quite stiff. Because my fusion was only like 3 vertebrae, so C4 to C6, I still have quite a lot of mobility in my neck, so I can look left and right fine. I can roll my neck in circles. My mobility is mostly fine from that perspective. It's just the muscles can get a little bit stiff and tight, which does limit the mobility a bit. And then I do get spasms in my neck. It used to happen quite often, like closer to the injury, where I'd get this like spasm in my neck, and then I would have to like wait for it to release or see a physio to get it to release. But now it happens a lot less frequently. Then overall, my right side was affected quite a lot more by the injury and by the paralysis than my left side. So my right hand was quite severely affected, and I had to work like really hard at getting my right hand able to actually like be able to write with it and to recover it to the extent that it has. And now my right hand, like, it's mostly fine. It's just like quicker movements that I struggle with. So the one thing I often show is like flicking my fingers. So with my left hand, I can flick my fingers like perfectly fine at quite a fast speed, but with my right hand, when I try and go at a speed, the fingers don't really open up properly. So I can do it slowly and force it to open up, but when I try and go quickly, that's what happens. And then my right leg as well, my glute is quite underdeveloped compared to my left, and I have my exercises obviously that I'm working on that to try and correct that imbalance. It's gotten a lot better in the past few years, and my glutes have gotten a lot stronger, but the right is still quite a bit behind the left in terms of their relative strength. And then the last thing that affects me is in very cold weather, my muscles kind of seize up a bit more. Yeah, if that's the way that I can describe it. So it's basically just, it takes my muscles like a while to warm up. Like if it's particularly cold, they don't go into a spasm. It's not a spasm, but they just feel like a lot more tighter, and it becomes like my movements are a lot stiffer, and it becomes like a bit more difficult for me to move when it's cold. And that also has gotten quite a bit better since like in the past few years. It used to be really, really bad in the first like year or two after my accident, and now it's just kind of when it's very, very cold that I really struggle with it. And yeah, I think that's everything. It's hard to kind of think about sometimes because it's become so normal to me. It's like just my life, and I adapt and get on with it now. But when I like compare it to before, or like compare it to like other people that have never had this sort of injury, you can kind of then see all of these like little like quirks and things that I still deal with. But mostly I'm fine now. Thank you so much for watching this video. I know quite a few people from like my TikTok that I posted were interested in knowing the story of what happened, and I figured it would just be nice to kind of put the whole like story and everything in one place in one video that I can refer people to. I think I pretty much covered anything, but if you have any questions, leave them in the comments below. I'll do my best to answer all of them. Maybe I'll even do like a Q&A about this whole topic at some point, so definitely leave your questions below. Like the video if you enjoyed it, and subscribe to my channel if you want to see more from me in the future. Thank you so much. Bye.